Hello, welcome to Leadership and Management. My name is Kim McAllister and I will be providing the lecture for today's topic. Why does cost matter? We're nurses. We take care of patients regardless of the cost. However, as a manager, you're responsible for operating within a boundary of expense versus revenue or profit versus cost. There are many factors that affect the cost of care. Chapter 12 does a great job of explaining these. We're going to look at the basics of reimbursement, utilization, and cost of services and see how those impact the budget. Cost is a measure of price and utilization. When the price for services and the number of people utilizing the services remain as expected, then the cost remains as expected. If the price or the utilization rise, then the cost will rise. If you have a sudden surge in census, what happens to your cash flow? Do supplies dwindle? Compare this to your personal budget. If you suddenly have unexpected company arrive and they expect to be fed, what happens to your grocery budget? If you add a new member to your family, what happens to your budget? Reimbursement is essential to survival of a healthcare organization. Understanding the requirements and the guidelines of reimbursement are required to maximize revenue. The U.S. Census states that 84% of Americans have insurance. There are a variety of reimbursement methods depending on the type of insurance that patients have. We're going to look at the most common, DRGs, diagnosis-related groups, and we're going to look at value price purchasing. DRGs are used as a prospective payment system that predetermines the amount that will be paid for conditions. They are based on the ICD codes, that's the International Classification of Disease. The system does not take into consideration acuity, and it does a poor job of reflecting the amount of nursing service that's required. Value-based purchasing is a system that provides incentives and bonuses to healthcare organizations that meet quality requirements. A set of 10 indicators are tracked along with patient satisfaction, and the success in meeting requirements impacts the reimbursement rates. You have this link on your slide. And these are the program measures. And then here is your patient satisfaction. What we are looking at this year is, we are on the fiscal year 2020 plan. These are the measures that are being recorded through the end of 2018. So you have catheter-associated UTIs, central line infections, C. diff, MRSA, elective delivery before 39 weeks, myocardial infarction, heart failure, pneumonia, total hip arthroplasty, and then Medicare spending per beneficiary. Some states, Medicaid also uses value-based pricing. In Texas, they do. You can read through the rest of this and see what information that holds. When the indicators are tracked along with patient satisfaction and the success in meeting requirements impacts reimbursement rates. When they're not met, patient complaints are excessive. The participating agency can lose money and be fined. Nurse managers must understand the reimbursement method to comply with regulations related to the method. Remember, reimbursement is linked to revenue. Determining the budget is the role for the manager. Some hospitals still determine the budgets for the units. Making the nurse manager responsible is more common. Regardless, the nurse manager must understand the budget to plan and staff correctly. The personnel budget is determined first. To staff correctly, the unit of measurement of service must be measured. For a hospital, it can be the patient days. In the OR, it could be minutes or it could be hours. For a clinic, the unit of service can be the number of visits, the number of treatments, and for home care, the number of visits and type of service, such as nursing visits, the nurse aide visits, therapy, and so forth. The basic formula for workload is the workload volume equals the hours of care per patient day times the number of patient days. The patient's acuity level determines the number of hours of care that they need. Next, determine how many employees are needed to provide the care. Full-time equivalents are used, but you must remember that if you have several part-time employees, you have to consider that when staffing. A full-time employee who never takes any vacation works 2,080 hours a year. Add up the number of vacation days, paid holidays, and the average number of days the person is out sick to determine the FTEs for each employee. These days are considered non-productive time. Education days for participating in required education and development may or may not be considered non-productive time depending on your organization. So you need to take that into consideration as well. The rate is calculated at 20 hours for 1/2 FTE or full-time equivalent. You also have to consider the staffing plan. Are your employees working 3 12-hour shifts a week? If so, then you've got to take that into consideration when making the calculations. So why does it matter to nursing? Nursing services are not reimbursed separately from the hospital stay. Because reimbursement is not based on acuity, it does not reflect the true cost of care. Nursing service is seen by many administrative officials as the greatest expense of the hospital rather than its greatest asset. As managers, we must help administration understand the value of what we do. Nurse managers must find ways of reducing costs and promoting revenue. So now you're ready to begin the budgeting process. The nurse manager must examine the needs of the population that it's serving, economic factors, reimbursement, and patient satisfaction. Review the objectives for the organization. Are they in line with the mission and values? Using these two assessments will help the manager determine the budget in relation to the organization. Develop specific and measurable goals. These will relate to the current status of the budget. Were supplies overused? Did the personnel budget exceed expectations? Then goals should target reducing the expenditures. Any variance, which is a cost increase or decrease of over 5%, must be examined. Productivity must be monitored by the manager. Hours per patient day is the common measure for hospitals. If the standard of care is determined at 30 hours of patient care a day, and there are 30 patients, then 360 hours of care should be given. If the number of hours drop below that level, then patient care was either more efficient or not fully given. Efficiency is critical to saving cost. Managers should routinely monitor employees for efficiency. Your unit may be part of a department. Your budget must fit in constraints of the larger organization, so request a copy of the department budget. The cash budget is the monthly operating plan. It includes the cash received and the bills that are paid. Even profitable organizations can run out of cash if they have a surge in census. The cash budget is the responsibility of the financial officer. The nurse manager needs to understand the cash budget so that capital expenses or supply orders can be planned at times when cash flow is expected to be greater. You may find that you need to increase your budget. To accomplish this, you must provide documentation to support your request. Negotiating and adjusting goals are required. Evaluate the budget as you move forward. Examine daily, weekly, and monthly expense and revenue reports. Plan for seasonal changes, such as a decline in some summer months or predictable times of the year when admissions rise, such as flu season. When I worked on an orthopedic unit in Montana, we had an increase in staff during the weeks that rodeo season was engaged. Planning reduces the need to employ travel or agency nurses, which saves expense. In addition to the personnel budget, supplies and other expenses, often called the other than personnel services budget, must be calculated. Capital expenses, the cost of new equipment, remodeling, building a new wing, must have a lifespan of more than 1 year and must exceed the normal spending cap. Organizations usually plan for capital expenditures each year. Obtaining funding for capital expenses is competitive with other units. A capital expense that can increase revenue is more desirable. Cost and revenue must be considered when planning a capital expense. Supplies are a source of expense and must be tracked carefully. Hospitals have documented up to $1 million in loss related to charges not assigned for supplies. Nurses must carefully record supplies and document their use in the nursing record. Understanding the patient's reimbursement allowance for supplies is also critical. Finding less expensive options for treatments or supplies that do not negatively impact quality is an ongoing goal. When nurse managers explain the budgetary constraints and implications to the staff, they're much more willing to participate in controlling costs. Encouraging nurses to help each other to complete charting and other tasks within the shift time reduces overtime. Improving patient education increases compliance with results and results in fewer readmissions and shorter patient stays. All nurses must work together to control cost. Look for trends in patient census. Have you noticed a sudden decline in patients from a particular physician? Find out why they prefer a different hospital. Did your agency lose a contract with an insurance company? Find out why and try to reestablish relations. Is there a patient service need that's not being met in your area? Do patients have to travel long distances to receive care? Find out what that service is and recommend a plan for offering it if that's feasible. Nurse managers must examine cost, expense, and revenue to create a budget which meets the needs of the unit, the department, and the organization. Become active in the budget process. Ask for financial reports. Most informatics systems in use in the hospital can provide managers with the reports easily. Informatics systems also help track expenditures, supplies that are not documented correctly, overtime, patient hours, and acuity. Use these tools to become financially savvy.